It is often said that maintaining a healthy weight range, doing regular exercise, eating a healthy and balanced diet, as well as not smoking, helps us live a long and productive life. Is that enough, though, to prevent one threat called pulmonary hypertension? Joining us here in the studio is Dr. Arif Mulla, who is an advanced heart failure and pulmonary hypertension cardiologist at Dubai Hospital, part of Dubai Health Authority. Dr. Mulla, great to have you with us in the studio. Can you first of all just tell us and explain to us what pulmonary hypertension is?
So pulmonary hypertension is a disease of the arteries of the lungs. The pressure in the arteries goes up, and that leads to the symptoms that cause the problem in these patients.
Can you tell us about the Emirates Cardiac Society campaign? Does it particularly target this pulmonary hypertension?
So the campaign is about, taking care of your heart. So the whole point is really everything got to do with your heart, whether it's heart failure, heart disease, coronary artery disease, or pulmonary hypertension. All of these are related to the heart. So it's really a comprehensive awareness campaign that they're trying to target and to inform the public. And I'm glad that I've been invited for this to actually make people aware of this disease. It's an uncommon disease, but it can be fatal if unrecognized and untreated, because the treatment is there. It can be diagnosed and managed as any other chronic disease.
What sort of symptoms should we be watching out for with this disease?
The problem with this disease is that the symptoms, there's similarities to other diseases like heart failure or asthma, and that's why a lot of patients end up being misdiagnosed as having other problems or ailments before they actually recognized to have pulmonary hypertension. And some symptoms are, shortness of breath, fatigue on exertion, but the sinister signs are really fainting on exertion, and that's really a sinister sign, and that really should lead the patients or public to actually go to and see a doctor about this.
What would you say are the main causes of this disease?
So there are multiple causes. You can have genetic causes, you can have HIV, congenital heart disease can cause it, clots in the lungs can cause it, diseases of the left side of the heart like valves can cause it. But the main ones that we really need to focus on is because there are 5 groups of different diagnoses. It's really group 1 and 4 that are treatable with pulmonary hypertension drugs.
How do you diagnose the disease?
It's diagnosed with blood tests, echocardiography, ultrasound of the heart. There are certain nuclear tests that we have to do. And at the end, before we start treating any patient, we really need to do a right and left heart cath, where we measure the pressures inside the heart and make sure this is true pulmonary hypertension and it's not something else related to something else, or it can be treated in a different way.
Can routine checkups, identify this disease ahead of time?
Not in every person, but the best test or the screening test for this disease is echocardiography, which is ultrasound of the heart, that can at least show you whether you have elevation in the pressures of the arteries of the lungs or no. And from there, you can actually send the patient to an expert to actually see whether the patient has it or not.
Can the disease be successfully treated?
It can be successfully treated and managed like any chronic disease. But the problem is that a lot of these patients usually come late in the disease or get diagnosed late in the disease.
So would you say that the development for preventative measures is getting better?
We're trying to actually, that's the whole point of this awareness campaign, is to make people more aware of this disease so that they actually seek attention for their symptoms earlier than later with the experts.
We'll leave it there. We've run out of time, unfortunately, but really appreciate you speaking to us this evening, Dr. Arif Al Mulla, consultant cardiologist. Thank you.
Thank you.